dialogue on virus, vaccines, and variants, which is going to be led by the Internews Global Health Advisor, Ida Yost. Ida will be co-moderating with my colleague, Christophe Hatiezu. Ida, the floor is yours.
Thank you so much. Hello, everybody. I don't know if you really need to see my face, but I will quickly say hello by face. Hello, very nice to see everybody. Yes, thank you for registering for the course. I'll take the video off so that we can look at the slides. I'll take it off in a moment or two. I just wanted to say that if you were coming expecting to hear what the latest is on a certain variant or which country is going to procure which vaccine, when and where, this is not the place for that, because I mean, WHO is holding news conferences about this kind of thing. In the countries around the world, there are news briefings and news reports about this fast breaking news all the time. This is more about how do we navigate, how do we make sense of this news that is coming at us at such a fast pace. And what I would really, really like to achieve, this talk or the training will be in 4 sections, is to actually take a pause after each of the 4 sections. I think when you signed up for the course, you saw that we wanted to talk about the science, about access, about logistics, in other words, how the vaccine is delivered, and then also about uptake, or how to ensure that the COVID vaccine is trusted, or what to do when the COVID vaccine is not being trusted. So it's incredibly, incredibly dense. It doesn't cover the breaking news. The breaking news is all around us, and I know we are all following it wildly all of the time. So I'm going to switch my camera off for now. And say, as I've just said previously, the news is breaking incredibly fast. I mean, the virus news, the news about this new virus, just landed on our doorsteps. And it wasn't very long after that already there was news about vaccines. That in itself is incredibly staggering, as I'm sure you've already heard. But I must say, I listen to webinars and hear some of the world's top experts speak about this all the time. They are themselves still staggered and sort of congratulating themselves, if you like, about this. And we should also really appreciate how staggering that is. But unfortunately, since November, December 2020, the news about variants having emerged also burst into our landscape. And that caused a lot of concern and of course more questions. And now certainly we're thinking about the virus all the time. We're thinking about all the vaccines that have already been developed and approved, some already being rolled out. And now we're also thinking about the variants. So the 4 areas into which today's discussion are being divided, as I said, were the science, access to this science, the rollout of this science, or the rollout of vaccines, and then uptake. So in the science, I just come across, I mean, we at Internews work with journalists around the world, and we try to listen to your questions and try to see how we can have it answered. But I must just say, the question of how a vaccine works, how does it work, keeps coming up. The question about whether we should be concerned about this fast speed, the thing which I've just said is so staggering and so impressive, should we be concerned about it? And then what about the variants? Of course, should we be concerned about it, and how do they themselves impact on the excellent news we had up until a certain point about vaccines? So how a vaccine works, it's important that it is giving you immunity to a disease. It means that if you're vaccinated, in all likelihood, I mean, it doesn't apply 100% of the time, but I mean, that's how vaccines work. It's about the entire population. But for an individual, it means it gives you immunity to a disease. So whatever the bacteria, the virus, and other pathogens around that can cause disease, for which there is a successful vaccine, you would not become ill with that disease. Of course, we've known this about vaccines. Any of us, following health and, the successful eradication of so many diseases around the world, or near eradication, know this about vaccines. I think it's in recent times that we've only really become aware of this platform or this method of making a vaccine, which is an RNA or messenger RNA vaccine. What that really is, how that one works, is it literally delivers a message to your body and say, this is how you make a viral protein. And the viral protein enables you then to trigger a successful immune response. So the old-fashioned way is called a whole microbe approach. This is a slide from the WHO, but it just lets you know, and I think it has a lot to do with the old fears about vaccines, is that there is an inactivated or a dead or a vaccine, and sometimes a segment, a virus, a segment of the virus contained in the vaccine, and it sends a message to your body that it recognized, so that in future, if that virus were actually to enter your body, the body would have already made antibodies recognizing, because it's seen a part of it, it's seen the non-live part of that vaccine. It can now also make antibodies when you're vaccinated and if you should get exposed to that virus. This new mRNA-based vaccine delivers a message to the body. This is how you make a viral protein. The body then makes that protein, and that enables you to get an immune response. We have seen so much misinformation and concern about that our DNA will be changed. I don't even really want to repeat it here, but I think all of us on the call have heard about that. But mRNA does not integrate into human cells. It cannot change our DNA. Vaccines cannot change our DNA. In fact, viruses can change our DNA. So a person who's infected with HIV has actually a changed DNA as a result of that infection. So we should rather be much more concerned about not getting a viral infection rather than being concerned about the vaccine and our DNA. Another key term for us as journalists to be aware of is the difference between efficacy and effectiveness. We've heard this efficacy word ever since about September, October, November, December. We have heard these fantastic efficacy results, 95%. Recently with Sputnik, also over 90%. Wonderful efficacy data, but it's just always important for us to know that those were studies in ideal conditions, and of course vaccines are not in ideal conditions. They're here with us in the heat. They're in the places where people can forget appointments. They're in places where variants emerge, so it changes. On the question about should we be concerned about speed, yes, there have been a lot of questions. No, we should not be concerned about speed, but yes, there have been a lot of questions about speed. And people ask, how on earth was it possible to develop a vaccine so quickly? And a friend of mine who's a science journalist says this question really tickles her a lot, because it shows this growing interest in science, but it also shows that a lot of people haven't fully grasped all of the aspects of science that help us understand how vaccines work. So the reason number one why we shouldn't be concerned is that vaccine science has been around for decades, but this is the first time, 2020 was the first time that the world's scientists started developing a vaccine in 2020. And we all know that the science of 2020 is better than the science of 2019, is better than the science of 2011, and better than the science of 1987. So in all of this time, through vaccine science, HIV science, vaccine science, through Ebola vaccine science, scientists have been honing and honing and honing their science about how to develop a vaccine. So it wasn't developed out of the blue. The other reason why we shouldn't be concerned about the speed is that some viruses are much more difficult to develop a vaccine for than others. So we know that the HIV virus or the HIV vaccine is still elusive, and that HIV vaccine science has gone on for 30 years. So people think, oh, well, that's a reason for us to be concerned about this fast one. But it is to do with a virus type. So the type of virus that HIV is, it's a lentivirus, a long-acting virus, versus a coronavirus, which is in fact the other coronavirus vaccines have been developed. So the virus type makes it easier to develop a vaccine. Funding is a very important reason why there has been speed. I mean, I think we've followed this as well, you know, from the World Bank to the Bill and Melinda Gates Foundation. private philanthropies, and of course, massive investments by governments around the world towards vaccine development. There has never been this size of investment in the development of a single vaccine in such a short space of time. So, I mean, money makes things possible. There has been a tremendous scientific focus on this job. Scientists are competitive. That's one reason why it's gone fast. But also, there is so much at stake. We know that it is a pandemic. We know that scientists around the world are interested in finding a solution. And we also know that we've seen the devastation that it's caused, both in economic terms, in our individual lives, and just in terms of a really changed world, that there is reason for this brilliant science that is standing on the shoulders of giants to now be focused on this singular goal to develop a vaccine. And then the last reason there is really incredibly important, and that has to do with a tremendous amount of collaboration amongst science institutions around the world, which they do through sharing data, through publishing the process of vaccine development as they go along. And in computer science, we know about parallel processing, and really the same has actually happened in the vaccine development world. For instance, where one lab is looking at a specific aspect, perhaps with immune response, another lab might look at another aspect of this vaccine development, and then they combine the two. So instead of kind of each lab having to go through all the processes on their own, they learn from one another, and then it actually progresses several steps ahead. So far for question number one, how does a vaccine work and should we be concerned about speed? There's a smiley. There is incredible excitement about how well the vaccine science had gone up until a certain point. One might say up until November, December, perhaps January, we were in a honeymoon phase with vaccine science because we were in a vanilla phase with the coronavirus. I know we're going to go to this poll in a minute, but before we progress and go to, I just wanted to complete this one point and to say that smileys all around, excitement. Despite all the terrible news, there has been excitement from the science community about how fast the vaccines have developed, and also, they've made it clear to us that we shouldn't be concerned. So now, before we go on to the variants, if a COVID vaccine were made available for you now, would you take it? 80% of you say yes. Christoph, is there a chance for more people to participate still?
Yes, I have launched the poll. The first question is now on.
Yes, and I can already see some of the results. And let's continue voting, please. Okay, so if you can all see the poll, if a COVID-19 vaccine were made available for you to take now, would you take it? And maybe we should also ask, in terms of what we've discussed so far, would you take it? Okay, so we can progress. 75% of you say that if the vaccine were made available for you now, you would take it. Okay, great, let's continue. Next question is, so I can share results, I see. %75% say yes now. Let's go to the next question, Christoph.
Yes.
Now, if a vaccine with higher efficacy was available to you in a year's time, would you wait till then? This result is very interesting. Please share it, Christoph.
They are still voting, I think.
Still voting, okay.
They are still voting. More 30 seconds to end it. Okay, 50-50.
Can you all see the results? $50-50. That is very interesting. Can I ask you all there what you think of those results? Anybody, please comment. Please unmute yourselves if you're not unmuted. What do you think of those results?
This is Bea Ida.
Yes.
It surprises me that 50% of this particular group would wait. So just a thought, but there's nothing wrong with it. Yeah, someone said I'd take one now and then the better one a year later. Yeah, I think so too.
Others, you can unmute yourself.
Okay, good. So
Abdullah, I will wait because I'm more concerned about efficacy. Abdullah Erkulebe.
Are you saying you will wait, Christoph?
Abdullah Erkulebe. I will wait because I'm more concerned about efficacy.
Right. Okay, that's very interesting, Abdullah. I think we will get to a discussion on that, and I think that I find this result actually not so surprising because I think we prize efficacy. I mean, we want things to be effective, but there is also another very important principle about the basics of how vaccines work that may make the now answer more correct. From the reading that I've done. But anyway, let's stop the poll and we'll get to that point. I think this is obviously a very, very interesting finding. Okay, so I'm going to stop sharing so that I can see my slides. So we were on that third question, what about the variants? Okay. So these are the kinds of headlines. So now the smiley disappears and we heard this very concerning news about variants and we saw these kinds of headlines. Scary 22% vaccine efficacy in South Africa comes with heaps of caveats. So in the headline there's a bit of a hint that the 22% isn't necessarily what we should focus on. And then we have another, the business tech headline was, here's what comes next for South Africa after the AstraZeneca shock. So we've got scary and shock as headlines in there. And let me ask you or any of you, I mean, what has been scary or shocking to you ever since you heard about the variants and vaccines? Anybody on the call, tell me what has been, why do you think there's a scary headline and a shock headline there?
Yes, Abdallah, go on.
Yeah, hello.
Hi,
yes.
Abdallah speaking.
Yes.
Yeah, you see, the scary thing is what I think is the current vaccines were developed for COVID-19 and not for the variants. So it simply means to me that there has to be new vaccines have to be developed to tackle the new variants. If I'm correct.
Absolutely, thank you. That is absolutely the first question. I think when we heard about the variant that emerged in the UK, that was the first news, and then the variant that emerged in South Africa, and then Brazil. And do you note that I'm talking about that emerged, it's not called the UK variant or the Kent variant or the South African variant or the Brazil variant at all. It is that scientists in those parts of the world had posed a hypothesis. They said, hold on, something different is happening. Let's do genetic testing. They were proactive, and in some countries the ability is there and in other countries not. I'll say that in the US, there is ability to do genetic testing of viruses to check for variants, but the US is very, very far behind in what it ought to be doing. Scientists there are admitting this. In the UK and South Africa, I think the scientists have been really proactive. I'm very proud, I'm South African, of the South African scientists who've been so proactive. So naturally in the media, the variant got this name, but it's really just that the variant was present here and was detected and described by South African scientists, who then immediately shared the results with the WHO, and immediately other labs across the world who can do this kind of testing started to realize this was a good idea, because there was this second wave emerging that was concerning us. But thank you for that, Abdullah. So, you know, that word scary is in there, is indeed what many people felt, but at the same time, the word caveat is also there. It tells us that the science is deeper than simply suddenly being worried that there is absolutely no use of this vaccine. And indeed, interestingly, today and yesterday, in fact, this was announced that the World Health Organization actually still backs the AstraZeneca vaccine, even if the variants are present, because behind the headline is a much more nuanced story. The one has to do with the fact that any protection is better than nothing. And the other also has to do that, you know, some of that efficacy data needs to be much more closely examined to see in what populations this is true, under what conditions does the 22% apply. And the science is actually still, I mean, the findings are still really on the smiley side, if I may say, especially because of the following reason. Number 3 in there. So soon after this news emerged, I think we also all saw news that the fact that scientists are developing ways to get around this variant issue. They are calling it the problem of the day, that's for sure. All scientists working on this issue, that's immunologists, vaccinologists, vaccine scientists, epidemiologists in the various labs around the world. But at the same time, because of this issue we mentioned about standing on the shoulders of giants and this incredible collaboration, that there's already this mixed method that they're exploring. And as I said, WHO at the moment is actually saying to COVAX, go ahead with the vaccine, even the AstraZeneca vaccine, which kind of has been earmarked for large parts, for instance, of sub-Saharan Africa. There's a tendency to want to compare the vaccines to one another. And there's strong guidance about the fact that leave it to the experts to do that, because also the studies aren't all designed in the same way. So in order to really compare one vaccine to another, you need to know what population groups were in that study. You need to know, the finer detail and analysis of each of the vaccines that are, they are all in the headlines at the moment. But do listen to the questions of your audience. And they do have questions about them, and try to answer them. In other words, point them to the scientists. And this then leads me to the fact that when we try to answer for our audience these complex questions, I want to say as journalists, we will trip ourselves up if we try to do it ourselves. We must find the closest expert, acknowledged expert, for instance, from the WHO or from Africa CDC, or a vaccine scientist that you know in your country, who can just explain the science and without complicating it. But I think the most important lesson from all of this scary science and all of this news that is so difficult to grasp is that as journalists, we just need to get much more comfortable with communicating that science is evolving. For me, that's the biggest tip about the science at the moment, is that the science is impressive and the science is evolving. And really honestly think about it. If it hadn't been a pandemic and if the news wasn't so all-consuming, and this was about a development in malaria or TB or cholera, we wouldn't have been following the news in this day-by-day fashion as journalists, and our audiences wouldn't have been following it like that. And these surprises, this need for scientists to adapt as they go along is really, really common in science, just as it is incredibly common for a virus to mutate. That is in fact what viruses do, to adapt, either sometimes for no real apparent reason, and most of the time to actually evade our immune systems, which have detected them. So they need to be clever because they need to, if you can put it that way, they need to survive. So I think the most important science lesson for me as a journalist is that we should be comfortable, we should find ways of communicating to our audience that the science is evolving and the day-by-day news breaking isn't the way that it will be. What we know today is not what we will know next week. And that to really trust that the science is at a very high level and it has our goodwill at heart. The most common access. Yes.
Before you continue, some colleagues have put interesting comments here. There's Leila Bale, yes, who says vaccines may be used for the new variants. This is worrying to me. What happens in case they develop vaccines can handle the variants? And then, yeah, there's that. And then there was a hand up earlier by Tido Betty. I don't know if he wanted to contribute to the conversation.
Let me just quickly say to Leila, this is, this is such a complex area you're asking about. And of course, it's a question on many people's lips. But as you can see, as I mentioned about what we've heard so far the guidance is that actually, and that links back to one of the questions at the top. Remember the 50-50 question? Would I take it now or would I wait for higher efficacy? So basically now with the variants, we've seen that some of the vaccines have lower efficacy, right? But the guidance from top experts in this area is just take a vaccine as soon as possible. Now, unfortunately, that's a theoretical discussion for all of us, I think, on this call, because of this issue of access, which is our next story question we're going to talk about. So we don't have it now, but it is interesting to think about it in theory. That even the lowered efficacy against the variants, which is what we now know, for instance, about AstraZeneca, the lowered efficacy is still better than zero. So for me, if it were me, I would say I would take it now rather than later. But your question, Leila, is exactly the question that is consuming scientists, is that how much time do we have? Because even though there's certain variants have been identified at this stage, we don't know if more will emerge, and we don't know how many, and we don't know if they will be more transmissible, if they will cause more disease, more severe disease, or less severe disease, or maybe less transmissible. All of those possibilities are there. So because of the unknown in the future, and because there are some knowns for now, it feels like good advice to me to listen to what the WHO is saying and what other scientists are saying. Something is better than nothing, and they're working, as I mentioned, as I noted here, that the booster idea and the mixing up of various vaccines is what scientists are really closely examining, absolutely around the clock at the moment, to give us the answer that you're asking, Leila. And you said Tidio had a question. Hello, Tidio.
Yes, the hand is up.
Yes, hello.
How are you? Please ask your question. I can't hear Tidio. Are you asking? I think I'll just go ahead for now. Sorry.
Hello?
Okay, Tidio, go.
Yeah. Mine is a concern on the vaccine. As we know that the vaccine is a virus itself, which is being somehow made dormant and which is when it is injected to the people, when the people receive it, it is not like it does not cause the sickness. But going back to previous case in 2015 in South Sudan, where some cases of polio were said to be due to a vaccine that was given in some part of the area, and that children were also getting polio from those children that were vaccinated. And we know polio vaccine is also it's also the same antigen that is being injected to children to prevent them from getting polio. So when we talk about this, sometimes some people then raise concern, okay, if this is a virus that is to be injected to people so that it prevents them, how comes this virus is not going to change again to become a problem when like to people who may be having low immunity? And you know, sometimes it's not easy to explain to some of the people in the local areas who are deep down in the villages for them to understand how this vaccine is made and how it works. So I don't know how you can help explain
I
it.
It's an excellent question to you, and it's a topical one, and it's a reason why people keep on fearing vaccines, because of the answer which I'll try to provide, but please also Google about it because it's a very important question, is that of course, and by the way, I don't know if you all know that there are now cases of polio in Liberia right now at the moment. So there's concern about that. So Liberia is dealing with COVID-19 and with polio at the moment. So as Tidio has stated, with polio, it can happen that that vaccine-derived polio emerges, and that's exactly what has happened in Liberia at the moment. So that immediately gives people a shock, like what? The polio arose or derived from the vaccine. And the very important question to know is, as Tidio said, is that when people are polio vaccinated and they have lower immunity, it is possible that they develop this vaccine-derived polio. It's specifically possible with the polio vaccine. But the very important thing to remember is, if there were no polio virus circulating, then even that derived vaccine would not have, that derived illness, the vaccine-derived illness would not have taken place. So the problem, as is described, and there's a good link on that on the WHO site, which I'll try to drop into the chat. I'll send it to Christoph to drop into the chat. Is that it is the problem is not with the vaccine itself, but it is with low vaccination coverage. So if a population is fully immunized, they will be protected against both vaccine-derived and wild polioviruses. So in polio, it's called vaccine-derived versus wild. So anyway, it's good that you asked it, and it is one of the reasons why people fear vaccines, because it can happen, but just also to say that it happens in far fewer cases than if there were no polio vaccine and polio was just, you know, spreading in a community. And of course, polio is really deadly and had been almost eradicated. Anyway, so let us move on to access, because that's somehow even a little bit linked to Tidio's question, because of course the entire population being vaccinated with the COVID-19 vaccine is very, very far off, and it's maybe feels like a far off dream at this moment. This is let alone any fears or any hesitancy. So again, in terms of access, as journalists, we must be absolutely sure that we know, how does a country get a vaccine? That's one of the common questions. How does an individual get a vaccine? And what are the challenges about telling this story? Are the common questions that I've come across And what I mean by how does a country get a vaccine is, you know, how does it work that in terms of this, what we're hearing about is this global scramble to get enough doses into a country to make some kind of difference, or at least start the process. How does that all work? So in order for us to tell that story or answer the questions, we first of all just need to absolutely be very sure that we all know how COVAX works, the COVAX facility. We also need to know, I think most of the people on the call are based in sub-Saharan Africa, so the second one is really relevant for us as well, is there are also regional acquisition efforts, so efforts to acquire the vaccine. For instance, the African Vaccine Acquisition Task Team. It's run via the African Union. The President of South Africa, Cyril Ramaphosa, leads that effort. And we also need to know in our individual countries, if our country by any chance has approached pharmaceutical companies and manufacturers one-on-one, because that is another way for a country to get hold of vaccine doses. And some countries do a mix of all of these. So those are the three things we need to know as a journalist in terms of how a country gets a vaccine. So, I mean, I think I'll just quickly put the question, the COVAX question there is Gavi and CEPI and the WHO together realized really, really early on in the pandemic that there will be a problem at some point to guarantee fair and equitable access for every country in the world. As we've seen, we've heard about, you know, how quick and fast and affordable it was for the wealthier countries and not so for the others. So this is a mechanism that says, look, let's at least assure that some percentage of each of these countries can have a vaccine, and that percentage can go up as funding into the COVAX facility increases, obviously. So that's another smiley. That's another good news story. The fact that there was this ethical realization that it can't just be about who can buy first and fast and who has the most money. But there is something that is not a smiley. A real negative is that where we are standing right now is that last night, Maria van Kerkhove, she's the chief scientist at the WHO, said this is unacceptable. And health advocates around the world and all of us feel it ourselves, that this is entirely unacceptable. So 130 countries of the world, in 130 countries, not a single person had yet received a single dose of the COVID-19 vaccine. So in other words, what COVAX is hoping to achieve and what the reality is at the moment, there is a huge gap. And that is, of course, the story that we are definitely following in our part of the world. The other thing to know is that, so why is this so? There's a $27 billion shortfall at the moment. Good news recently with the Biden administration, $6 billion was immediately pumped into that shortfall. So that means that most of the wealthy countries, as well as the World Bank, the Bill and Melinda Gates Foundation and others, are pumping money into this pool, if you like, which, you know, the closer we get to the 27 billion, the higher percentage is in low and middle income countries of people who can actually get the vaccine. And the World Bank is also actively looking at new ways to finance, you know, the very COVAX itself. Act Accelerator, I wanted to put that there because I just feel like whenever we talk about vaccines, we should always remember that vaccines need to be seen in conjunction with tests and with treatments, because it's clear from this shortfall that we won't have an overnight solution. We don't have it from a science point of view. We don't have it from an access point of view. And we also don't have it from the point of view that some people have declared that they will not be vaccinated. So the treatment funding and the treatment process must go ahead. The testing process must go ahead. And for ourselves, of course, we know that even people who have been vaccinated are told to continue wearing masks, to continue with the physical distancing, etc. So the ACT Accelerator looks at all of these legs of the problem comprehensively. And that's another area that we should know about, and again, find ways to translate that to our audience. So how does an individual get a vaccine? So the first question was, how does a country get it? Now, how does an individual get it? Now, we've already seen a lot of debates about vulnerable or at-risk populations, about frontline healthcare workers, about the elderly. So first of all, we need to know the science about that so that our stories are not unscientific. I mean, we must always demand for more and greater access when something is in the public good, obviously. But we must know as journalists what the science is about who is most at risk with COVID-19. Now the policy principles decided in your own country. Now each country then takes that science in the ideal world, and some countries have been lagging behind. I would imagine Tanzania is lagging behind. Countries who've been in COVID denialism, for example, or countries who've not been really proactive. So this again, where we come in as watchdogs, is what are the policy principles decided in your own country? So in your own country, you may have a smaller or a larger elderly population, or you may have a large population of obese people or people with diabetes, so those who are more vulnerable to COVID-19. And each country then decides, this is our demography, this is our, this is how the country is made up of old and young, ill, people who've already, in fact, some countries are also bringing in whether, those populations who've already had COVID-19, what should happen with them is a question that comes into the mix. And then each country actually drafts or ought to draft a policy about who's first in line, who's second in line, etc. So again, as journalists, we do need to know what our country's policy is. Will it be just health workers first, or will it be healthcare workers and the elderly, for example? Those are the things we need to know to tell that story. So I wanted to ask you to stop there and ask you, what are the challenges in telling this story? I mean, there are a lot of technical terms in there. Do you feel, those of you on the call, I mean, all of you, does anybody here feel like there's a specific challenge with telling this story? In other words, about knowing the policies in our countries, about following the ACT Accelerator, following this terrible money shortfall, the injustice about it, as the WHO has tweeted there, I'm just taking us back, or about understanding how COVAX works. What are the challenges that you can identify with telling this story? And let's see if we can find a few suggestions.
Ida, if I may,
Yes. Yes.
There's a colleague, Aminu Adamu.
Yes.
He's put something in the chat. If he can unmute himself, I think it will be better. And it tells us what he means with the chat.
Okay,
Aminu
so tell us.
Adamu.
Hello, good afternoon.
Good afternoon, sir. Go on.
Good afternoon, sir. Go on. All right, thank you very much. Yes, while I was listening to Ida, I was asking to understand that currently there are trial vaccines that are going on around the world. And of course, we are not certain, because if you look at the first poll that was posted earlier, 75% of people said they will go for the vaccine, and why 25% said they won't take the vaccine. And that's maybe because of the effectiveness of these vaccines. So I am asking that while the trial vaccine is ongoing, how effective it is so far. And because we see reports of people dying from these trial vaccines, could it be as a result of the variants? I want to know.
Yeah, okay. So thank you for the I don't know why there's a double sound. but I will. Does anybody know why my sound is repeating, or is it not like that for others?
It's good now. Continue.
Okay, thank you. Okay, thank you. Christoph, I've just posted a graphic into your Teams chat. Could you drop that into the? Maybe I can actually share that. Did you see that, Christoph? I think I have a really good illustration to help us answer your question. Did you see what I've just sent, Christoph?
Yes.
Okay, so I think your question that you typed and the question that you asked verbally was a little bit different. Just so we are very clear about it, is that people are not dying in the trials. People are still dying because of the virus. And I know it can get a bit confusing because there's news about COVID deaths and there's news about the vaccines and about the various trials. So Christoph will try to share for us something that really illustrates this point. And in fact, there is fantastic data that shows that regardless of all these percentages and everything we've heard, the big news story about what the vaccines have shown us so far is almost everybody has been protected from being hospitalized. Remember, most of these COVID vaccines have as an endpoint the protection against severe disease. What that means when you say a vaccine has a certain endpoint, in other words, what are you really measuring? What are you hoping for the vaccine to achieve? This vaccine, most of the vaccines have not been primarily developed to stop you from getting infected, but they have developed to stop you from being hospitalized with severe disease. And if you can see the graph, if you've been able to post it, Christoph, is it on the screen yet? Well, anyway, you will see a graph at the moment that shows you that the deaths that you feel you've heard about are actually COVID deaths that you've heard about, not vaccine deaths. Here and there, we have seen reports about adverse events, which is really very common. You know, when people are vaccinated also against influenza and any other pathogen, there is a little bit of a, there's something that you can feel around your arm where you've been vaccinated. Unfortunately, we as adults hardly ever get vaccinated for anything because it's children who get immunized in the normal programs. That's another huge challenge of the COVID-19 vaccine. But sometimes if you get, for instance, a yellow fever vaccine or some of those vaccines, or tetanus vaccine, HPV vaccine, which are more common in adults, people will say, oh, I felt a bit feverish for a day or two, or my arm was stinging. And that is sometimes described as an adverse event. And sometimes we as the media have done damage by not understanding that this typically happens after vaccination. So I don't know if I hope this graph answers your question, because I find it absolutely very exciting. It's really a whole lot of very good news in this graph. Okay, so we can take that off now, Christoph, and continue. Did that answer your question, Amina?
Yes, thank you so very much. It did.
There's a hand.
Yes, of course. I think it answered my question. Thank you so very much.
Thank you. Another question?
Yeah, my question is, what is the source of that graph? That is one. Then back to challenges.
Yes, no, that's a fantastic question. I do have the source. I will be forwarded to all of you, because it's something to watch, because that graph has been changing, as you know, because the Sputnik vaccine we only saw results of the Sputnik, that's the vaccine developed in Russia, became available something like a week ago, and that was added to the graph. The graph does have a credible source. I'm sorry that I cannot remember it right now, because I just pull it out in response to your question. I know how I got it is that it was tweeted by a very reputable vaccine scientist whom I follow on Twitter, who is Francois Balou, and I'll go back to his Twitter feed and let you know what the source was.
Okay, but the question as to what
I am so glad
in telling the
story. Yes, what are the challenges in telling this story?
I think one of the challenges in telling this story is realize in such countries where they keep data so secretive, they keep information about vaccines availability, vaccines distribution, and so on and so forth. In countries where there is no transparency in acquisition and distribution of vaccines, that could be a very good challenge in telling the story.
It is definitely a challenge, and I you know, we can't solve it today, and we can't solve it probably in a decade if countries are really secretive. But I think the good thing is that the COVAX facility itself also makes some news available. I think it's a place to build up contacts. A colleague of mine who's an active journalist who writes about it does get responses to some of her questions from the COVAX facility. So that's another thing that, I mean, it's another thing that I can try to forward to you that Christoph can then forward on to everybody else. Because sometimes within our own countries, we don't get the data we need, you know, but you're very right. In South Africa, it was very much like that for a while. And then on Sunday night, just so for you to mention it to those, we had a really impressive webinar by the health minister, by the head of the vaccine subcommittee within the Ministerial Advisory Committee, by 2 leaders of and it was a moment of that moved us forward, but because up until that point, many people also found it quite difficult to get all of the information that they needed. But I mean, I think we're very lucky in South Africa. I know that other countries are less lucky in terms of getting data. Okay, so shall we move on a little bit?
Sure.
Okay, so the next third item is logistics. So you'll notice that it's the same questions that I asked in Access. How does a country get a vaccine, and how does an individual get a vaccine? But it's asking the questions from a different angle now, from the point of view of logistics. So how does a country get a vaccine actually also involves logistics. So after you've purchased it and the access question has been somewhat addressed, you now actually need to get it. So either by ship or flown in. I mean, the AstraZeneca vaccine, the very vaccine that South Africa is halting for now, arrived, and there was huge excitement. It arrived from India, and you know, just a few days later, our regulatory authority then, in the meanwhile, had a look at the vaccines, and they announced that they saw that the expiry date of the AstraZeneca vaccine was April. And given that the logistics, you know, all the trucks, the refrigeration, the planning, the training, the storage, all of the logistics aspects had not been sorted yet, our regulatory authority then said with concern that we will not be able to get to the second dose by the time, for those who get vaccinated, by the time April arrives. So there was a logistics matter in that very concern. Is it arrived by ship, it looked fine. Up to a certain point, it was a positive story, and then it became a negative story from, you know, kind of not a smiley anymore, when we realized there was a logistics hurdle. After that, the variance hurdle was also discovered. So you see, these things are all intertwined, but sometimes it makes sense to just focus on one aspect of the story. So the question, how does an individual get a vaccine, is also a logistical question. So I'll just go like into finer detail. What we need to know in each of our countries is, what about the transport routes? If our governments have decided in terms of policy who's going to get it first, how do we get it to them? Will perhaps healthcare workers from rural areas be required to come into the city in some cases? We all have followed the news that the Pfizer and the Moderna vaccines require significant refrigeration, and even the AstraZeneca requires refrigeration of, I think, of up to between 2 and 8 degrees Celsius. So that does require electricity supply, etc. Do we know how it goes in our country with all of those aspects that have to do with vaccines? Of course, with logistics, there will also be tenders. I mean, already in terms of graft or corruption, and the COVID-preneurs that we have seen in many parts of the world will actually get tenders to supply, to transport, to refrigerate the various vaccines. So that's another watchdog story that we have for ourselves as journalists. So it's good for us to know that it isn't wrong that there will be tenders, because most countries will not be able to do it with their health system. Even in the US, Amazon and FedEx are involved in vaccine distribution. But it's important for us to know how vast it is. But at the same time, we also have to be watchdogs to be sure that, that there isn't corruption that comes with the logistics. A question that we can ask in some countries, I think Kenya, South Africa, Nigeria, is can our country manufacture a vaccine? So that obviously eases the logistics. And if we can't manufacture a vaccine, have there been efforts to strengthen that part of our health infrastructure? So those are questions around the logistics of a vaccine to ask ourselves. Again, just to illustrate how staggering it is, since we are, I think most of us live in countries which don't have a vaccine yet, we can tell that logistics story by using case studies from other parts of the world. We of course can tell it by explaining that our own country has power shortages, power supply problems, or not enough refrigeration, but it can also help people to understand how vast this logistics problem is by, for instance, talking about logistics problems in other parts of the world. Now, can you imagine Japan, a country that all of us associate with, you know, being ordered, it's first world, it's wealthy. It is a very well-organized country, and yet even Japan is experiencing logistical problems. Europe is experiencing that problem, the US and the UK, countries that are wealthier than those the countries where we live. So we have to be aware that it is really a vast logistical problem. Of course, refrigeration is key amongst that. And then that question is, how does it get into your arm? How does the actual individual get it now? That's not the policy part of it. The policy determines who gets it. The logistical question is, now staff have to be trained. There have to be communications, there have to be appointments. I think I saw a story in the New York Times yesterday or the day before about how difficult it is to make appointments, even with everybody being online in the US, to actually, in many cases, there have been real concerns with just the appointments alone for the first and then the second dose. So that's another staggering angle of the story, another angle of the story which we can really take on. And then of course, you know, if we are lucky enough to find people soon enough in our countries, and so by the way, in Egypt and in Guinea, 2 countries in sub-Saharan Africa, and sorry, 2 in Africa, Egypt and then Guinea is in sub-Saharan Africa, this vaccination has started. So some stories are beginning to emerge and will emerge from very soon about actual people getting vaccination. And those are really good stories to tell, and people who vaccinated are by and large really happy about it, and hopefully will tell our stories, tell their stories to us. Yes. On the hour.
Yes.
Yes. Okay, so I think what it is clear to me is that our time is not enough. So I would like to hear, I don't know how we're going to do this, whether we should continue or whether we should have a part B.
What if people drop it in the chat?
Sure, and for now, I think I'll continue, and then Tole and Christoph, if you could keep an eye on that, and then we decide how to handle it. But of course, I hope what we've had so far is useful, and that we can think of a part B at another time. It really was a huge topic to cover in one day. So anyway, this point is just to say that, of course, the vaccine itself on a shelf or in a fridge will not save lives. There have to be successful vaccination programs, and that is about the health systems and the logistics in each of those countries. But we are actually not so far from the end, because I think there was a great question by Lucadia that Lucadia sent to Christoph, and she said the media has an educational role towards the public. What are the best story angles so that we carry stories of hope and not panic? I really love that question. And on that, on the uptake question, the most common questions are, why are some people hesitant to take a vaccine? And what can be, or what should we do about it? So I think if I could just quickly say, because we have so little time, is that we do need to understand why people are hesitant. I think Tidio's question earlier gave us a bit of a hint. And I wanted to just share with you, because this really is a session with tips. One of the tips that comes from Internews' work in rumor tracking or rumor management, and sometimes not rumors, but just questions, Those are the things that our audience will be asking, and general people on WhatsApp, on Facebook, in the street, around us are asking questions. And that is what we journalists are there for, to have an ear on the ground. So I think we, as journalists, come naturally to this idea of responding with fact checking. We respond by correcting the misperceptions, by correcting the false information. Just as I was responding, it's such a natural journalistic instinct when somebody, one of you said, sorry, I've just forgotten your name for now, but said, we hear about people dying in the trials, and I knew that it wasn't the case, so I corrected it with a fact. But we also emphasize that a reality check is incredibly important. And what do I mean by reality check? You can say to somebody what the facts are, but the reality is, maybe let's take it to a much easier disease to describe. When you tell people that with cholera, it's very important that they, that the water is, they use jik, or, that the water is, before they drink water, that the water should be chemically treated. Or before doing a certain thing, they should wash their hands. What if the reality check is that those people don't have access to clean or clear water, to clean water? So in other words, then the questions will immediately be different. So I wanted to just encourage everybody to say, correct with facts. It is our job as a journalist. We inform, but we are also listeners. We should be listeners and say, where does the question come from? And can we maybe find a way to address it by really showing people that we've heard you. This is your question, this is your concern. And then finding ways to respond to it rather than just bombarding them back with facts, but realizing that their question comes from either a deep fear or from really not having the means to take better decisions for their own health. So that is really just a tip on that. And another tip on misinformation is, I think I myself have done it today. I have repeated some misinformation about the COVID-19 vaccine or even about COVID-19. We do it in discussions. And many of us, I think, might have caught ourselves just forwarding something without actually asking ourselves, is this misinformation really being believed out there? Or is it just a piece of media that's coming my way? Is it just a piece of gossip? Is it just somebody who thinks something and thought out loud? So basically, before we spend too much time and resources on correcting something, we actually need to be quite clear that is that actually, are we spending more time on a conspiracy theorist agenda than on the facts, than on educating and on listening? So it's just a tip to bear in mind. And then I wanted to hear from you what you all think we can and we should do about it. And after we've heard this, the last thing I had just to say to you is, of course, it's vaccines. Vaccines do not save lives. It's vaccination that saves lives. So under access and logistics, we know that it's successful vaccine access programs, vaccine rollout programs that save lives. But when it comes to the individual, it's that choice to be vaccinated that saves lives. Again, then whether the vaccine is effective, whether it's on the shelf, whether the truck has delivered it, whether there's been communication to you, if an individual doesn't want to take it, the vaccine is also no good. And this is where Lokadia's point comes in, is about the educational role we have to play so that more people would be vaccinated. But I mean, let's go to that question. What do you all think we can do about this fact? There have been fantastic results that you gathered, Christoph, from some people on this call who also responded, asking what are the questions, what are the fears, why is it that people don't want to be vaccinated? Some people don't want to be vaccinated. From listening to those, from listening to people around you, what do you think we can do about it? Anybody? What can we do? What should we do?
I think as good as communicators, there is nothing better than unveiling the truth by telling the scientific aspect story about the vaccines themselves. And since there is no lies in science, people should believe science, especially when we bring out this from the scientists and communicate to the people.
Right. And any other ideas from anyone else? What about you, Aminu? You said there's no lies in science, but I mean, let's explore this issue further, where we said that so much of the science is still evolving. What role can we play there? Because I have heard, definitely, we've all heard this, that people are wondering why the WHO can change its guidance. Recently, I think a day or two ago, the CDC, the Centers for Disease Control in Atlanta in the States, actually started recommending wearing a double mask, especially in the light of variants. Then people would come with questions like, why did they say, first of all, was their opinion at the beginning that masks were not necessary? Then later, a mask, and now later, 2 masks. How can we as journalists, I want to get to this issue. How can we as journalists hold hands with scientists to help our audiences understand that everything we're learning about COVID-19 is still evolving? Can we do that? Abdallah, sorry. And as we wait for a response, because I really would like to know, I would actually like to appeal to you to make that a really, really important part of your work, is to fully accept that the science around COVID-19 is still new. It's evolving at an impressive speed, too fast for us to grasp actually. And that if we can communicate one thing about COVID itself, about science in general, and about the COVID-19 vaccine, is that the science is impressive and the science is still evolving, I think we would be doing our audiences a huge favor. And it's not easy because it's the opposite of a clean, clear headline. A clean, clear headline says something is black or it's white, not that there is a gray area, but there are gray areas still in science, and that is not a problem. Scientists, whenever they have an answer, they seek for the next answer. So it's a process of seeking, and our audiences are seeking with us, but we must bring them along and explain to them that this is how science works. So this is really my appeal. So on the bottom of the slide, some of the things that we see in the media, and some of it really kind of contributes to people doubting vaccines, doubting that the science is genuine and is ethical. We may still come up with new headlines, but I would actually really say, find somebody in the science community, find a close friend who's a health journalist who's covered this for years, find somebody who can be your buddy to actually translate for you what it means when something seems like, it's difficult to grasp. And after it's difficult to grasp, it's even more difficult to put it in the words that are really good for our audience. So I would say, find a person. Yeah.
On that, there's a comment by a colleague, Richard Boyo Katami. He says there seems to be competition in producing the COVID-19 vaccines. Is indeed dangerous to human life, as bogus vaccines could be offered to unsuspecting countries who badly need to immunize their people.
Yeah, I think there are 2 parts to your question, Richard. I think the one is there is competition. There is absolutely competition. There's actually a kind of an international race. I mean, it's very interesting that Russia called its vaccine Sputnik 5. It's through the Sputnik spacecraft that Russia signaled to the world decades ago that it was ahead of the US. And it's kind of like I was saying, maybe we'd be ahead again. So yes, there's competition amongst countries and amongst scientists. Even within countries with a lot of research capacity, there are different research groups who are competing. And I want to say that we all know, as journalists, we are also usually quite competitive. That competitiveness in and of itself is not a bad thing. Competitiveness often leads us to want to be first, to want to be the best, to want to be the most thorough, to actually, for scientists, is to make a breakthrough and to make a difference. So I wouldn't say that competitiveness on its own leads to bogus vaccines. Competitiveness on its own can lead to the best of scientists actually really being clever about how to apply for funding, how to collaborate with people who have a complementary skill. The competitiveness, I think, well, first of all, we can't do away with it. It's part of human nature, and top scientists are mostly quite competitive. It doesn't necessarily lead to bogus vaccines. I will tell you that South Africa already received its first consignment of fake vaccines, not by a known lab. It's just stuff that was sent to the country, and over here and many other parts of the world, people will want to sell that because they know vaccines are in demand. So, but fake vaccines are not made by reputable scientists. They're just made by business people who see that people are desperate and they want to make a quick buck. And it's obviously very tragic and sad, and we must do stories about that as well. But of course, hopefully that will be, I mean, that was discovered by the police in South Africa. And so that is now, you know, it's been squashed. So I just want to say, Richard, I think, yeah, let's not think that competitiveness in itself will lead to a bogus vaccine. I think the competitiveness has also been coupled by a lot of collaboration, by the way, because it's such a major effort. If you think about the variant that was identified in South Africa, after the geneticist in South Africa who worked on that made it known to the WHO, immediately collaboration started between South Africa and labs in the UK. So there's also collaboration. There's also taking pride in your achievement, but then immediately collaborating. That has been really noticeable throughout this period of intense COVID-19 science.
Absolutely. Tulani Ngwenya says our role is to work with scientists to break down the complex information, science for science purposes, to a language that various communities can understand and follow. Thank you, Tulani. Ida, back to you.
Beautiful, Tulani. Yes. So let me ask if there are any more questions. I really am sorry that we overran. What is great and what I am very, very happy to share with you is these are the 4 areas that we had identified as, you know, having a lot of questions around them. And we are at Internews with a group of amazing colleagues developing an e-learning course reporting the COVID-19 vaccines. It will be something which you'll be able to follow in a self-paced way, you know, self-study, as is the case with online learning. It will be completely for free, obviously. And how we want to do it is from time to time enroll different groups, maybe from a certain country or a certain project, a certain time of the year, into the course. And then what we can then make available is that mentors can actually provide webinars, a bit like this one, but on the specifics now. So it won't be a rush like this. You know, under science, there will be several modules, under access modules, working through the COVAX issues and so on that we discussed, the logistics. And then on uptake, several modules as well, because it's a very, very complex area. How do people behave? Why do they fear vaccines? Why do some fear vaccines? What can be done to overcome that? All of these have several modules, which you can then study in your own time. And then we will sometimes have webinars to bring everybody together, to bring all the key questions together. And there'll also be the possibility of mentors working with you as a study participant in the e-learning. So I'm very excited about that course, and it will be out in March. And through this group and other groups, we will let you know. I also wanted to let you know about, in case you don't know yet, about Internews' Health Journalism Network. It has a Facebook page, and I think Christoph has the detail on how to join through that page, which you'll also put in the chat. And also through that group, through the COVID-19 updates group, of which Christoph is the administrator, and through any other networks, we'll let you know, because it will be available for free. And I hope you will sign up.
Thank you so much, Ida. So about let me start about the e-course, the e-learning that's going to be soon launched. So the most important to know is, as you have said, that it's self-paced. You plan according to your availability, and after completing the course, you get a certificate. So
yes,
yeah, I think we are all ready for the course.
Yes.
Then about Health Journalism Network, I have posted here the link. You can register. Let me send it again. Can register and become member of the Health Journalism Network. There is also a Facebook page that you can follow. I'm shortly going to send the link also. You can just follow all the activities. Then obviously after registering or completing registration form that you can find on this link posted in the chat. Thank you.
Thank you. Good. Okay, so I think, are there any questions for those who can stay on or want to stay on that we can try to answer?
Maybe if Bay is here, maybe a bit more about the HJN.
Is Bay still there? I think she has left now.
Yes.
Yeah. But I can tell you all a little bit about it. So the Health Journalism Network, or HJN, is a Facebook-based group where anybody who has interest can join. And the beauty about it is not, I mean, there are other groups of journalists who are together on a Facebook, on a WhatsApp chat in a group, or who, for instance, in Kenya, there is Mesha, in Uganda, there's Hejnu. There are lots of health journalism associations out there. One doesn't replace the other. This is just a further place for networking. But I think what is very nice about this one is that it is completely global. So, for instance, the point I made about sometimes if something is not yet available in your country, but you want to do a story about it, it helps to do an international case study. I know we all know as journalists that sometimes you need an angle of your story in another country, or you need a full case study from another country, because I think of Tanzania, for example. I mean, I really pity those journalists who there's a part of the story that they can't tell because there's denial of COVID in that country. But they are actually allowed to tell COVID stories from other countries. So in a way, the message can get through to their audience. And, in very exciting ways, by linking up with people from a completely different part of the world, you can have a really fresh story, which perhaps somebody else could not get. You can get a story from somebody in Colombia, in Thailand, but still for your own audience, but just make interesting comparisons. And that is possible on this Health Journalism Network. Yeah.
There are two hands, Aminu and then Anna Chibam.
Yes. Let's go with Anna, then Aminu.
Okay. Yes, I want to ask about the e-course.
Hi, everyone there.
Aminu, let's start with Anna this time.
Can you hear me?
I hear you, Anna, then after that, Aminu. But go ahead, Anna. We hear you.
Hello, can you hear me?
Yes, we hear you.
Okay. Okay, I'm Anna Chibamu. I'm sorry, I came late. I was delayed some way. So I wanted to know if my questions have been answered and if I'll be able to get them after this program.
I think you sent them to Christoph, right?
Yes, I did.
Yes. We can send you an email with those questions, Anna.
Oh, thank you so much. Thank you very much.
Okay, and you, Aminu?
Okay, I want to ask if the e-learning course reporting the COVID-19 vaccines, is it going to be a free or a paid course?
No, for free. It will be free.
Okay, thank you.
Sure. I'm sorry you missed the session, Anna, but there will be a recording that, and so in other words, you can then listen to the whole training.
Okay, thank you very much. Ida, now your last word before we wrap it up.
Yes, now I think for me the last word is I'm happy there was a little bit of time for questions. I'm sorry that it was so rushed because it was really about an actual overview of the four main stories around the COVID-19, the science, the access, the logistics, and then the uptake. In other words, people actually wanting to get vaccinated. It is so complex, but I think for me a motto is that vaccines do not save lives, vaccination saves lives. But of course, we need a vaccine, and that's the science. The vaccination can only happen if we have access, if we have proper programs to distribute the vaccines, and if people want to be vaccinated. So we have to follow the vaccines, and we have to follow the process of what it takes until that vaccine actually goes into our arm, and we are protected as an individual, and our whole society around us is also protected. And there are a lot of inequities, there are a lot of unfairness in the world around this. I think if we can focus on that and actually play our role to ensure that vaccines come to our countries, we will really, really play we will be playing a major role in ending the pandemic.
Thank you very much, Ida. Thank you very much, colleagues. Thank you for your time. We look forward to you joining the HJN network because when you join that network, there are a lot of opportunities that you can get. There are webinars, there are trainings, there are all those one-on-one opportunities from around the world. So kindly take time, check it out and let us know. And back to you, Christoph. Thank you very much.
Thank you.
Thank you. Thank you very much, everyone, for joining. We will send the recording afterwards. If you have any other question or comment, kindly reach out by email. Thank you so much. Have a great day.
Thanks. Bye.
Bye.